Imagine your aging grandparents in hospital. Chances are they will receive a urinary catheter. In fact, every 1 in 4 hospitalized patients will rely on one urinary catheter. This medical device brings essential relief for the patient, but it also introduces a persistent and possible life-threatening complication called catheter-associated urinary tract infection. So why infection is so common? Our body is actually good at fighting bacteria until a medical device is inserted. The chance getting infected increased by 100-fold. The reason is this static plastic tube become a comfortable highway for bacteria to colonize. And inside the tube, bacteria would swim up directly into your bladder and form this impenetrable matrix called biofilm. Once that happens, even the strongest antibiotics wouldn't work. So how do we fight this? We look to the most brilliant engineer, nature. So as an adult, every day we are breathing 10,000 liters of air, full of dust and microbiome, but we don't continuously get lung infection, right? That's because cilia, in your airway, this hair-like structure continuously beating and sweeping all the invaders before they can settle on. So this is our body's original frontier defense. What if we give this static plastic tube its own immune defense? That is my PhD do. So we engineered this smart catheter with active topograph. Essentially, it's a microscopic, magnetic-driven artificial cilia with lining in the inner wall of the tube. Because this surface is continuously modulating and sweeping, so bacteria cannot physically attach on the surface. The process of swim up is also inhibited. We built this from ground up and tested it both in the lab model and the rabbit model. It both shows significant inhibition of the bacterial invasion. And the best part of this design is we made it completely wearable. So powered by this tiny circuit board, patients are now tied to the hospital bed. They can walk around freely with this device and receiving this 24/7 continuous protection. By mimicking this nature's immune defense, we are doing more than just redesign our medical tube. We are bringing safety, freedom, and dignity to millions of vulnerable patients. Thank you.